how a supplement that bodybuilders use might help with improving libido. Then, are over-the-counter solutions for ED worth trying? Plus, the science behind why we get attached after sex. Next on Sex Talk.
Welcome to Sex Talk, where we answer the questions you've always wanted to ask about sex and relationships. I'm Dr. Leah Janine, Associate Professor in the Department of Health and Human Performance at Nova Southeastern University. And joining me today is Sex Talk correspondent Derek Latta.
It's a pleasure to join you today.
Yeah, absolutely.
Dr. We have a ton of questions from our viewers.
Looking forward to it.
Absolutely. So let's get to the first one. You ready?
All right.
I'm not too sure about there's a male or female asking this question, but maybe it doesn't matter, or maybe your answer could help.
Okay.
Does having sex on the first date ruin the potential for a long-term relationship?
Ultimately, it depends on the individuals and the relationship. There are some studies that show that sex early in a relationship can lead to lower quality relationship, but that isn't to say that sex on the first date will ruin your long-term compatibility. If someone wants to be intimate on the first date, they should evaluate their own vulnerability and emotional investment. Make sure you're not too invested or moving too fast. A few studies looked into relationship progression and found that early sex led to moving in together more quickly and possibly a lower relationship quality. But also keep in mind the early stages are some of the most exciting parts of the relationship, and the frequency and the quality of sex in those early days doesn't always mean that it will be the same later on.
Now, you mentioned one study. Are there any other studies?
There's a bunch,
okay.
Right? So there is a survey that looked at losing interest or respect after hooking up too soon. And this survey, 83% of women aged 18 to 35 said that they feared a man would lose interest if they had sex too soon, while 70% of men said that it didn't matter. Another 2023 Huffington Post article based on a Love Honey survey found similar results, with 60% of men and 43% of women actually reporting having sex on the first date.
So women will hold out because they think that the man's going to judge them, but in reality, it doesn't matter.
Yeah, I mean, I would never want to be with a man who judged a woman for having sex with them on the first date. Like, I think it's absolutely ridiculous. Two people had sex really early on in the relationship. Why would the woman get judged? Like, takes two to tango.
I agree. Okay. So fun is good.
Yeah.
Ready for the next question?
Fun is good.
Fun is always
Take
good.
away on that one.
Thank you. My husband's job puts him at a risk for HIV. Is it safe for me if he gets tested frequently?
Well, assuming he's not a sex worker or injecting drugs, he shouldn't be at any extreme risk. But there are some things that everyone should do, like following standard precautions at all times. This would mean using goggles, gloves, or other barriers. Washing hands and any other skin surfaces after contact with blood or bodily fluids is very important. And you always want to be careful when handling needles and disposing them properly.
Okay. Are there any other ways of preventing HIV?
There is pre-exposure prophylaxis, or PrEP, and it is highly effective if taken correctly. It's known to reduce the risk of HIV from sex by about 99% and reduces the risk from injection drug use by about 74%.
So even if you're on this, you probably still should use protection.
That's right, because you'll still want to protect against other STDs. And remember, PrEP is most effective when taken as prescribed. Otherwise, the results are not the same, and some research shows that it isn't quite as effective in younger men.
You know, just curious, how widespread is HIV? What's going on? I know it used to be a lot before. Have we controlled it? What's going on?
Well, it's estimated that 39 million people around the world have HIV, and some don't even know they have it. While the numbers are improving, there is much work to be done. Let's look at what this HIV expert has to say.
We used to estimate that about 13% of society that has HIV doesn't know that they're infected. That's gone down to about 8% now, but it's still not low enough. We would like to know that everybody who has HIV knows their diagnosis, gets connected to care, and starts treatment so that they can protect themselves and decrease their risk of presenting to others and infecting others.
So a lot of this is getting tested. Where can people get tested?
Well, you can get an HIV test at your local health clinic, community HIV testing center, hospital, or health department. Your regular doctor can also test you for HIV, or you can even buy an HIV self-test kit online or at your local pharmacy.
Wow, interesting. So CVS, Walgreens, you can go there and get it. Oh, nice. Didn't know that. Thank you. Our next question, Dr. Leo. I always get attached after sex. Why does this happen, and how can I be better? I don't know, better? Is that bad?
Yeah, it's not necessarily a bad thing. Well, I guess it's a bad thing if the person's not attached to you too. So if it's a one-sided attachment, that could be a problem. But feeling attached after sex is a common experience, and it often has a lot to do with the release of oxytocin, a hormone and neurotransmitter known as the cuddle hormone. Oxytocin is associated with trust, empathy, and bonding, and the levels spike during sexual activity and orgasm for both men and women. This hormone promotes intimacy and is thought to play a role in maintaining fidelity by discouraging closeness with other potential mates.
So listening to your answer, would you say that this closeness is due to chemical reasons and not partner?
Well, it all depends, right? And so there are some women that even will say that depending on how great the sex is, then the more attached they become, which could obviously cause a problem. So you're becoming attached to somebody that might perform better in bed, but they might not be the best person for you, right? Oxytocin enhances our feelings of trust and connection, which can sometimes blur the lines between genuine attraction and hormone-induced bonding. This is why some people have an attraction to someone they typically wouldn't, just because of that sexual connection. After sex, oxytocin surges, amplifying feelings of love and happiness, which can make someone feel deeply connected. Just be mindful of the powerful effects of oxytocin. It can enhance feelings of connection that it's crucial to ensure your relationship is based on more than just these hormonal surges.
Yes, it's cool. Like when you start a relationship, everything is great, it's amazing. So what you're saying is that there's a lot of chemical reaction going on in your body, in your brain. So and eventually it kind of dies down when maybe you get to know the person better.
I guess, and you know, there's a myth that the person that's going to be your better sexual connection isn't necessarily one to marry, and obviously that's not the case either. I remember seeing a show, and I can't remember what it was, but someone said like, well, you don't marry best sex guy. Best sex guy's in prison somewhere, right? So it was just showing that connection can really mess up your mind.
Is there any way to tamper the oxytocin?
No, I mean, your body's going to be producing it. Like it's why you want to cuddle after sex. Your body's going to be producing it. If you're really worried about it, I mean, don't have sex with somebody you really like that isn't connected to you, or just try to be rational about it. I mean, I think that we're all affected. Like for me, my one thing is like, if I'm really tired, I think the world is going to end. So I'm like, all right, be rational. Like tomorrow when you get sleep, it'll be okay. So maybe it could be the same type of thing here. Like this is just my oxytocin levels. This guy is not worth it.
Our next question, Dr. Leah. My wife doesn't orgasm from oral. What can I do to make it better for her?
Sexual satisfaction is a crucial part of any intimate relationship, and it's fantastic that you're invested in ensuring your partner's pleasure. However, if your wife isn't orgasming from oral sex, it's important to approach the situation with understanding and patience. For men or women, the pressure to orgasm can make things harder. If you feel like you have to orgasm, it can make it less likely to happen, whether the pressure comes from them or you. Also give it time. If the relationship is new or they aren't as experienced, it could sometimes take a while for a woman to reach orgasm with their new partner.
Guys, I need you to listen up to what I'm about to follow up with this question.
Oh,
okay.
boy.
So, what can you tell us about the female orgasm that might help?
Well, vaginal intercourse alone doesn't always result in an orgasm. Many orgasms come from clitoral stimulation. The latter portion of the vagina doesn't have as many sensory nerve endings, so focusing solely on penetration might not be effective for everyone. Both clitoral and vulval stimulation is often the key to orgasm.
Vulval?
Yeah, vulval.
Okay.
So
nice.
what people mistakenly say as the vagina, which is really just the canal, so the whole thing is going to be the vulva. So touch on the outside while you're having sex.
Okay, so there's nerve endings there, not just in the clitoris area.
Yeah.
Okay. Oh, interesting. Great tips. Any other tips?
Well, if your wife can reach orgasm through masturbation, mutual masturbation could be a helpful way to learn what techniques work best for her. Pay attention to how she touches herself and try to incorporate similar methods into your sexual routine. Some people prefer indirect stimulation, like pressure on the upper vulva, rather than direct clitoral stimulation. Overall, sex should be about the process, not just about the product. While orgasms are amazing, some women find that sex without them can still be pleasurable and fulfilling. Focus on what feels good for both of you in the moment, without the pressure of needing to achieve an orgasm. Good communication during and about sex is key, as it is to being open to exploring different activities that might bring her pleasure.
Question. Orgasms for women, is it only happens with vulva and clitoral stimulation? Because you'll see a lot of, like, for example, porn, not that I watch
I knew you were going
but
there.
they're like going crazy and there's no stimulation, it's just penetration and there's nothing touching.
It completely depends on the women. Like, and some women have no problem orgasming multiple every time, and then others just have a really difficult time. So a lot of women get in their head, so it just depends on how comfortable they are with sex or even how shy they are. A lot of it's how they're raised. And there's some actual studies that show anatomically some women are just built better to have multiple orgasms versus others that are not, in terms of closeness of various things. So it really just depends, but I think a large part is really comfortability. Like, the people that have talked to me about having orgasm issues were typically the people that were very, very shy in terms of talking about sex or experimenting with new things. So, you know.
Yeah, you mentioned it 1,000 times before, it's communication. Like, hey, tell me what you want, or tell me what you like or don't like, and let's avoid all that wasted time.
Yeah, and I mean, have fun with it. No one wants to sleep with somebody who's like just doing them a favor, right? Like, just have fun, like, you know? No, but like, you don't want that. Like, nobody wants that. So you want to feel like both people are into one another. And I just think that, in all aspects of life, not just sex, people need to not take themselves so seriously.
Okay. You guys heard that, Dr. Leah. Anyway, our next question, Dr. Leah. My relationships never last. Is love bombing real, and what are the signs? First of all, Dr. Leah, what is love bombing?
Love bombing is a manipulative relationship tactic where one person overwhelms another with excessive affection and attention, especially at the beginning of the relationship. This can often feel flattering and exciting, but it's crucial to recognize what it is: a strategy to quickly establish control and emotional dependence.
You know, first time I've ever heard of this, by the way. What are some of the examples?
Common love bombing behaviors include constant attention, excessive compliments, and extravagant gifts. Someone might demand your time, engaging with you often, and expecting quick responses to messages. They might also make grand statements about plans or the future that they don't likely intend to keep. Initially, love bombing can feel like living a romantic fairy tale. In a dating world where emotional connections are often hard to come by, when someone showers you with attention and commitment, it can seem like a dream come true. However, the reality is that love bombing is a tactic designed to make you overlook red flags and become emotionally dependent quickly.
Red flags. So what are some of these red flags? What are these warnings? What should they be?
The warning signs, right? Know that love bombers create an illusion of a perfect relationship, showing only their best sides. This can make it difficult to see their true character. The old saying, if it's too good to be true, it probably is, often applies. But be cautious if the pace feels too fast, the gestures seem too grand, or there's a resistance to slow down. If they end up mirroring your interests and core values or future faking, it might be a sign that it's love bombing.
There's something else I haven't heard before. Future faking. What is that?
Oh, yeah. So it's when someone makes plans and then doesn't follow through. Maybe they bring up marriage or traveling together. It could be as simple as talking about something on the weekend and not following through. Ultimately, it creates a false sense of security. If you're on the lookout for love bombing, watch for the signs and take advice from trusted sources. If your friends think you're moving too fast, look to see if there are other signs.
I think even the word bombing should be a warning. You know, something's going to happen.
Yeah, but oftentimes people don't see it. You're like, oh, this person's really into me. It's wonderful. And then they flip.
Okay.
So.
Thank you, Dr. Leah. Our next question. Does testosterone help with sex drive? First of all, what is testosterone, and am I pronouncing it correctly?
Yes, you did. It is pronounced testosterone. A lot of people incorrectly pronounce it as testosterone, but it is testosterone. And it has gotten some attention for its potential health benefits, like boosting sex drive. It has a similar chemical structure to testosterone and belongs to a class of compounds known as ectosteroids, which are natural steroids that can influence the body's functions. Unlike synthetic steroids, testosterone may attach to different receptors in the body, potentially providing unique benefits without some of the risks associated with synthetic steroids.
Dr. Leah, so what is ectosteroid and how do you take it?
So Ecdysteroids are a hormone that is involved in the growth and molting of arthropods, right? And testosterone is just one of the supplements that's using ecdysteroids. It typically comes in a pill form of about 500 milligrams divided into 2 pills.
All right, and how does it work?
Well, testosterone is thought to support testosterone production in the body. Testosterone is a crucial hormone involved in muscle growth, strength, metabolism, and sex drive. Low testosterone levels can lead to reduced muscle mass, increased body fat, and a decline in libido. And higher testosterone levels are associated with increased muscle mass and enhanced sex drive. However, the effects of testosterone on testosterone needs a lot more research.
Okay, so help me with this. So people are using this for what? What are the benefits?
Well, athletes and bodybuilders often use testosterone in the hopes of enhancing performance, building muscle, and boosting their libido. While that makes sense, testosterone would aid in these things, the research simply isn't there, at least not for humans. There was a study that found it beneficial in mice. However, a colleague and I did the first ever human clinical trials, and we found that it did increase sleep quality according to the Pittsburgh Sleep Quality Index, and it showed a trend towards significance and increasing overall mood according to the profile of mood states. However, we did not find that there was any change in fat mass or muscle mass, and we did not see any benefits in orgasm, sex drive, sexual desire, or arousal. So all of the claims, we did not find them to be true.
Okay, so there was no benefits, but were there any risks in taking it?
Testosterone is generally well tolerated when taken as a supplement. Common side effects include upset stomach, while less common side effects may include headache, dizziness, and changes in blood pressure. It is essential to notice that testosterone may interact with certain medications, so consulting a healthcare provider before starting this supplement is important. But again, I wouldn't recommend it because I kind of think it's a waste of money.
You should start with that. It's a waste of money. Don't even bother going there.
That's what I found in this one study. But again, as I teach all my students, one study, even if it's mine, does not necessarily mean it's fact. It needs to be replicated. And in our study, we only had 30 people because, like I said, it was the first human clinical trial. So with a larger number of people, it may help. So I'm not blatantly saying it doesn't work. I just wouldn't invest money in it as of now.
The gender-wise, in those 30 people, how was that divided?
It was 16 women and 14 men.
Okay, and you didn't see benefits?
Nope, there was no differences in men and women.
Okay, beautiful. Next question. Yep. My partner doesn't believe in therapy. How can I convince him it will be best for our relationship?
Well, before discussing therapy with your partner, consider why you want them to go. Ensure your motivation is out of concern for their well-being and not solely for your own benefit. Your motivation will shape how you approach the conversation. Talk to your partner when both of you are calm and in a private setting. Avoid bringing up therapy when in a fight or when your partner is stressed or agitated. A calm and private environment will help ensure a more productive conversation.
And what do you say in these conversations?
Well, frame your concerns with an empathetic I statement, such as I am concerned or I have noticed. Share what you are observing and feeling and provide clear reasons why you could believe that therapy could be beneficial. Don't frame your suggestion for therapy as an ultimatum or some form of control. Instead, express your concerns openly and invite your partner to consider therapy as a tool for their benefit. This approach helps prevent your partner from feeling attacked or rejected. Foster understanding by letting them know that you love them and that you want the relationship to work, thinking that this might help.
What if the partner's hard-headed and just doesn't want to go to therapy, thinks it's a waste of money and time? You hear this all the time.
Oh yeah. Well, that's always an option no matter how thoughtful you are in approaching this conversation. This could be due to a variety of reasons, as internalized stigma, a belief that talking to loved ones is enough, or simply just not being ready for therapy. If your partner refuses therapy, seek additional support for yourself, although placing the burden of emotional support on you can be overwhelming. So consider setting boundaries and engaging in self-care to protect your own well-being. If your partner's behavior is causing significant turmoil and they continue to refuse therapy, you might need to reevaluate the sustainability of the relationship. While you want to be patient and understanding, it's important to consider your own needs and your own well-being.
You know, I guess some people just might be put off because they don't know what to expect. Maybe they think they're going to be ridiculed or talked down to or made feel guilty. Therapy doesn't do that. Therapy is supposed to kind of all around betterment.
Well, there's nothing to worry about. Here are some tips on what to expect from a sex therapist herself.
My name is Jordan Rulo. I am a licensed psychologist and certified sex therapist. Meeting with a psychologist is an important part of your sexual health assessment here at the Women's Health Clinic, and let me tell you why. Sexual health does not occur in a vacuum. It's impacted by biological, psychological, interpersonal, and other life factors. Here in the Women's Health Clinic, we are committed to making sure you receive comprehensive care for your sexual health concerns, which involves addressing all of these factors with a team approach. Sex therapy may sound scary, so let me explain. First and foremost, I'm a licensed psychologist. I'm trained to assess and treat a variety of mental health issues, such as anxiety and depression. As a sex therapist, I have also been specifically trained and certified to work with individuals and couples with sexual concerns.
She's right. Sexual health is impacted by so many factors. They can really work with you to get to the root of some of your challenges and help you work through them.
Thank you. Our next question, Dr. Leo. I have a sexual kink. How do I tell my partner?
Well, try focusing on your approach, starting with some self-reflection. How important are your kinks to you? Are they a core part of your sexual identity or sexual satisfaction, or is it just something you want to enjoy occasionally? Knowing this can help you communicate your needs to your partner more effectively.
And what are some of the ways you can approach this partner more effectively?
Well, take it slow and gentle. Allow your partner to ask questions and be upfront about what you are thinking and your desires. Your partner might already have an idea about your kinks, but be mindful of your language. Instead of just saying kinky, just let them know what you want to explore and what you find arousing.
Yeah, what if they're not interested? Are they being selfish?
Well, no, I mean, you really have to respect their boundaries. If they don't consent, then it's not an option and you'll need to look into other ways to get your needs met. Perhaps you and your partner can come up with something else that's equally as exciting. Hopefully there is room to find a common ground, because being able to explore together is more important and will lead to a better bonding in the long run.
Okay. Question number 9, Dr. Lee. What's an over-the-counter solution for ED?
That's a good question, because not everyone is a good candidate for a PDE5 inhibitor, but there are some solutions. One study found that 60% of men who couldn't take the pill achieved an erection within 10 minutes from a newer gel, Med 3000. Sometimes the pills don't work for certain people, or they take too long to work, so gels can be a good alternative.
Just curious, how do these gels work physically? How does it work?
Well, the gel is applied to the head of the penis and evaporates quickly. It usually has an initial cooling effect that is followed by a warming sensation. And what is happening is that the nitric oxide is released, relaxing the muscles and increasing blood flow.
Okay, I can see the benefit and the positive. Are there any negatives to this?
Well, in their study, only 2% of people who used Med 3000 had side effects like a headache or a burning sensation.
Okay. You ready for your next question?
Yep.
Okay. Is it ever too late for adult circumcision? And what are the risks?
Circumcision is a practice rooted in religious, cultural, and medical traditions. While it is most commonly performed on newborns, adult circumcision is also a viable option. Research has shown that circumcision can significantly reduce the risk of sexually transmitted infection. Studies in Africa demonstrated that circumcision reduces the risk of HIV transmission due to the presence of the immune system cells in the foreskin, which HIV targets, and the potential for small tears during intercourse that can facilitate infection. Circumcision has also been linked to a reduced risk of human papillomavirus, or HPV, and herpes simplex virus type 2. Circumcised men also have female partners with a lower risk of cervical cancer, as HPV is a major risk factor for the disease. Other benefits include protection against penile cancer and prevention of foreskin issues like infections.
Are there any risks in adult circumcision?
It's a surgery, so there are risks like infection, bleeding, or complications from anesthesia. Although serious complications are rare, some adults may have longer recovery time and more pain and discomfort. And then there's the risk of the penis not looking as expected after surgery.
Okay. So I wonder what they expect, because they know what their penis looks like.
Well, there are botched circumcisions. If you ever are really curious, Google botched circumcisions and you will see a whole slew of things. There was an issue, actually, it was male twins. This was a long time ago, and they actually cut off the penis. And so what they decided to do at that point was to just raise that male as a female. And they looked at it from a psychological, they gave him hormones, but then as this male was like 15, 16, looked like a male, wasn't responding to the hormones, and got really deeply depressed. And it was really, really sad, became addicted to drugs, as did the twins. So, I mean, there are horrible things that can happen. Obviously, that's far less likely now with the use of lasers, but you know, it is an issue, and fewer and fewer people are getting circumcised now.
So what's the recovery like? How long does it take?
Well, you'll want to make sure that you're taking care of the wounds to prevent complications and infections. It will also require avoiding sexual intercourse and masturbation for at least 4 to 6 weeks.
Does circumcision reduce sensitivity?
Some believe that circumcision may reduce sexual pleasure due to the removal of the nerve endings in the foreskin. However, studies have really shown mixed results.
Interesting.
Well, Derek, that's all the time we have. I've loved answering these questions, but we will see you next time on our Sex Talk program when we answer the questions you've always wanted to ask.